Hi again, this is Jim Rush, and once again, we're going through a series of annexes to your your emergency operations plan. And again, if this is the first one you've tuned into, the idea of this was basically just a thank you to all the good people who've been good to me over the years, who mentored me and were patient with me on my journey through healthcare, public health, and emergency management, and there were many. And so I wanted to leave some things behind for the current and perhaps the future emergency managers for healthcare, as well as the leaders in healthcare that have annexes that they can build as part of their emergency operation plan. The idea is basically to have the beginning of the document, an introduction by the Chief Executive Officer, and then an overview, and all hazards. This is the way this healthcare organization is organized for and responds and recovers from all disasters. And then as you go through that handbook, or whatever it turns out to be, you would point to see Annex. We'll say if you want to see where you get your supplies, check out the materials management annex. Same thing with human resources, how to develop your team. See human resources annex, and that's the one we're on today. So without any further ado, I just wanted to have a few things to go through. The human resources director has a very large role to play in the overall emergency operation plan, and in fact the disaster procedures across the board. One of the things is the human resource director needs to build out the hospital emergency management team. Full-time employees, part-time employees, temporary employees, and that may come in handy later on as we talk about FEMA public assistance program. What is and what's not covered for special categories of people who are brought in specifically for disaster procedures, disaster operations. And then also your volunteers, and we'll get into that later too. The hospital human resources director gets to assign everyone working in the hospital to a response and recovery team. That needs to happen when people come on board and when people leave and other people replace them. And so there's close coordination between the HR director and all the different teams in the hospital emergency operation plan. You have time and attendance and badging for all employees throughout the disaster and throughout recovery. We've all heard horror stories where there are people working in the hospital that should not be in the hospital and have no credentials, etc., no accreditation. That'll keep you awake at night. But anyway, the human resources annex basically will manage all those different categories of people and basically have safeguards in place to make sure that nobody gets in the hospital, nobody touches a patient without having the proper credentials. And again, time and attendance is very important as you look down the road at FEMA for public assistance after a disaster. That's if your hospital is a private nonprofit organization. The essential teaming partners that a human resource director needs to be close with, and that is basically the hospital emergency manager. That person should be proficient in FEMA's public assistance program and policy guide. There used to be a series of administrative policies that were called the 9500 series. Looks like that they have been superseded by the 2020 Public Assistance Program and Policy Guide. So that's a must have, must understand for the emergency manager. And we have to keep in mind that many times the emergency manager doesn't have 15 or 20 years of experience in healthcare. So not only would it not be wise, but it would be just detrimental to throw the whole responsibility for the emergency management program and the emergency operations plan all on the shoulders of the emergency manager without mentorship and help along the way. The chief nurse plays an integral part. So the HR chief nurse, chief medical officer, and materials manager need to all be very close partners with the HR director. And talked a little bit about the hospital emergency manager. They have in addition to the public assistance program and policy guide, it also has it refers to what is allowable for FEMA post-disaster grants for hospital full-time equivalents, part-time employees, temporary employees, and also straight time and overtime. The next teaming partner is the chief nurse or the chief medical officer. The Medical Reserve Corps, as far as I can tell right now, it's very underutilized throughout the country. And this is a wonderful asset, and it would be just flat wrong to not integrate your local chapter of the Medical Reserve Corps into your healthcare emergency operation plan. And I'm seeing that, at least in my mind, I see the chief nurse being the one who would have the most positive impact on membership for the Medical Reserve Corps. So I see the chief nurse as being the champion. Chief nurse also does credentialing, nursing education, and provides guidance for all temporary healthcare providers, both MRC, and also you have community independent healthcare professionals, physicians, dentists, chiropractors, and other medical professionals that you might bring into the hospital during disaster drills and for the real thing. What the accrediting bodies want to see is basically that guidance has been given to these professionals, and they're also informed as to who their supervisor team leader is. Now, the chief medical officer, again, as I see this, be a triage team establishment and trainer for the different teams, and also recruit independent healthcare providers. I think in general, if you present your leadership of your hospital to the community, and it's real obvious from the interactions you have that you have a very committed leadership group in the hospital, and it makes it so much easier for others to join you. Another partnership that the HR manager needs to have is with the materials manager. There's going to have to be contracts established between independent healthcare providers in the community. There's also a possibility of dialysis providers, chronic care specialists, endocrinologists, diabetes care specialists, respiratory care specialists, and contracting with community child care centers. And I'll talk on that just in a little bit. But basically, anything that has to do with contracts, you've got a materials manager who can really be a benefit to you in putting the contracts and the other MOUs, memorandum of understanding or memorandum of agreements. I like contracts much better because they are binding, and memorandum of understanding can just fall apart when you need them the most. And additional things that I think the HR department needs to get involved with, and again, this can be with your other partners, but you know, we have a 40% divorce rate in this country, at least. And that being the case, you're going to have a lot of single moms and dads in the hospital that, if their children can be cared for, and if they're provided with a family reunification center where they can have their children with them during break periods, during off shift, then you're going to have a much better chance of having a commitment and attendance by your healthcare staff. And the other thing that I think is overlooked sometimes, and that is have a relationship between the HR office and the state office for unemployment insurance. Because if you do need to lay people off, if in the worst case scenario is your hospital is shut down for a period of time, if you have agreements in place and everybody knows who does what and when with your state unemployment insurance office, it's going to go a lot better for everybody in the hospital, and I think it will reduce the stress. So that's basically human resources, and again, I thank you for tuning in, and we'll have a few other annexes to go through, and then I'm going to get into supply chain issues for post-pandemic and what we can do to rebuild the healthcare supply chain, and also mass casualty management. That is it's an area that I think might be useful and helpful to some of you. And again, I thank you for tuning in, and if you like the presentation, you want to see other ones, you need to subscribe and hit the bell, I guess. I'm new to this, so bear with me. But apparently you can subscribe, hit the bell, and YouTube will let you know every time a new presentation goes up. There'll be a number of additional ones. I think this is number 7. Probably be somewhere in the vicinity of 13 or 14 by the time we're finished. Thank you very much, and again, thanks for tuning in.